I'm Dr. Fadzlina Abdul Aziz. I am a consultant paediatrician from KPJ Ampang Puteri Specialist Hospital. Today's topic is about childhood asthma. The prevalence of childhood asthma among school-age children is about 10 to 12%. Asthma is caused by a combination of an environmental factor as well as inherited factor, which is genetic. Asthma is actually a chronic inflammation of the airway. This will cause the airway to be very sensitive or hyperresponsive, and because of this hyperresponsiveness, it leads to recurrent onset of wheezing. As asthma can be triggered by a few factors. One of it is actually an airborne allergen. Airborne allergen means things like pollen, house dust mite, pet denders, and then other factor can be respiratory infection, meaning common cold also can trigger asthma. Other than that, physical activity means sometimes children, when they are being very active, it can trigger asthma. Very strong emotion or stress can also trigger asthma. Besides that, certain types of food that may contain certain type of preservative also can trigger asthma. Children can have symptoms such as cough, and the cough is usually recurrent cough, and it's non-productive, means it's dry cough, and it's usually more common at night or early in the morning. Besides that, other symptoms like wheezing, means it's a whistling sound and parents can hear when the child is breathing. Some bigger children can complain that there is a chest tightness because of airway that is becoming tight. And other subtle symptoms are reduced activity in very young children, because physical activity tends to make them breathless, hence children tends to refrain themselves from being very active. Things like frequent laundering of bed sheets, not having pets at home, not having carpets at home, frequent cleaning can help. And then if the trigger is due to cigarette smoke, which is an air pollutant, so it is very important for a child to live in a smoke-free environment. If a child who have chronic, means very prolonged recurrent episodes of dry cough or cough at night, which is not resolving, you can bring the child for a doctor to assess whether this is cough due to asthma or other condition. For children who have asthma, it is very important to control the symptoms so that the child can live as normal and as healthy as possible.